Dear students, welcome back. Now we will see the tidal breathing or in quiet breathing what happens, what is the work of diaphragm. Now we will see in this video. In the previous session we have seen the fibers of the diaphragm, that is the costal fibers and the crural fibers, isn't it? And also the central tendon, that is the non-contractile part of the diaphragm. And the shape of the diaphragm and angle of pull of these fibers. So the shape of the diaphragm and angle of pull of these fibers are essential for its usual function. That means the respiration. Okay. Here the diaphragm is elliptical and dome shaped, normally elliptical and dome shaped. Its costal fibers running vertically. Now here you can see the costal fibers. So this side, the costal fibers which are running vertically like this. Okay. So the space, these vertical fibers which are just opposite to the rib cage. So that zone is called as zone of opposition. This space is called zone of opposition. Okay. So in this, actually this anterior side ribs are cut here to understand this movement of diaphragm. So you'll have this much like this. Yes. So this much shape you can find here. This much shape. Okay. So that is called zone of opposition. Zone of opposition. Okay. Now, what happened during inspiration? What happened during inspiration? When diaphragm contracts. So here mainly we are dealing about the costal fibers. During inspiration, when the costal fibers of the diaphragm contracts, and also the crural fibers also contract, but the crural fibers does not have direct action during inspiration, but these costal fibers will have a direct action on the diaphragm during inspiration. Okay, what will happen? So these fibers are vertically placed, isn't it? Yes, these fibers are vertically placed like this. So what happens? The shortening of the muscle fibers, that means the angle of pull is towards this side. The angle of pull is towards this vertically downwards. So these fibers are arranged vertically, isn't it? So the force is also acting vertically downwards. Okay, like this, vertically downwards. Then what happens? So the opposition, the zone of opposition here, the zone of opposition decreases here. What happens? The zone of opposition decreases. You can see the zone of opposition decreases. Normally it is more, but after contraction the zone of opposition is decreased. This causes, so the contraction, the shortening of the muscle fibers decreases the opposed diaphragm, which causes descent of the dome of the diaphragm. So you can see the dome of the diaphragm is going to descend because of the contraction of the costal fibers, which causes descent of the dome of the diaphragm. So this axial displacement of the dome, caudally ante kindaki. So this axial displacement of the dome caudally displaces the abdominal contents. So the abdominal structures which are present. So because of this descent of this diaphragm, it displaces the abdominal contents caudally. So the axial movement displacement of the dome caudally displaces the abdominal contents caudally. That means here the abdominal contents are compressed. The abdominal contents are compressed. Okay, so once these abdominal contents are compressed, what happened? The pressure in the abdomen. So the intra-abdominal pressure increases. What happens? Intra-abdominal pressure increases. So once the intra-abdominal pressure increases, this intra-abdominal pressure acts as stabilizer. It acts as a stabilizer for the descending central tendon. So we know that means ఈ డోమ్ ఉంటుంది కదా నాన్న, ఈ డోమ్కే సెంట్రల్ టెండాన్ వల్లనే ఈ డోమ్ షేప్ వచ్చింది. సో వన్స్ దిస్ ఐఏపి, దట్ ఈస్ ద intra-abdominal pressure increases, so this pressure acts as a stabilizer for the descending central tendon. Okay, ఒక్కసారి ఈ స్టేజ్కి వచ్చిన తర్వాత ఆఫ్టర్ రీచింగ్ దిస్ స్టేజ్ then what happens? Still there is a shortening of the costal fibers. So initial shortening of the muscle fibers decreases the length of opposite diaphragm, which causes the descent of the dome of the diaphragm, displaces the abdominal contents caudally, which increases the intra-abdominal pressure. This intra-abdominal pressure acts as a stabilizer for the descending central tendon. After that, what happens? If still, let us consider, still these muscles are again getting contracted. So after this IAP acts as stabilizer for the descending central tendon, and if there is continued shortening of the costal fibers, if there is continuing shortening of the costal fibers, so what is happening here? You can see inka ఏమవుతుంది, so it is started continually shortening against the stabilized central tendon. So ఏమవుతుందమ్మా, సో స్టెబిలైజ్డ్ సెంట్రల్ టెండాన్ని బేస్ చేసుకొని అగైన్ దీస్ మజిల్స్ ఆర్ గెట్టింగ్ contracted still. So then what happened? It generates an upward pull. It generates an upward pull. So already ikkada neekemaindi central tendon stabilize అయిపోయింది, isn't it? The central tendon is stabilized. So still contraction of this fibers మనకేమనిపిస్తుంది, రిబ్బు లోపలికి రావాలి కదా అనిపిస్తుంది. నో, సో బికాస్ దిస్ వన్ ఈజ్ స్టెబిలైజ్డ్ హియర్, సో ఆల్వేస్ ఫోర్సెస్ acts as pairs. So again this creates an upward pull. This creates an upward pull on the lower lips that results an upward and outward rotation of the lower rib cage. You can see the space is not nearer to this, this shape is not nearer to this rib cage. So the space is increased outward. The space is increased outward. So it creates an upward pull. It generates an upward pull and outward motion of the lower rib cage. Simply we can call it as rotated outwardly. Upward and rotated outwardly. The lower rib cage is moving upward and rotated outwardly. So this is called as bucket handle movement. So bucket handle movement takes place at the lower rib cage, isn't it? Pump handle is in the upper, isn't it? Upper rib cage. So in the lower rib cage, how this is happening? So once this IAP acts as a stabilizer for descending central tendon and there is still shortening of the costal fibers against the stabilized central tendon, generates an upward pull on the lower lips that results in upward and outward motion of the lower rib cage, that is called bucket handle movement. Okay, sorry, bucket handle movement. Okay, so this is occurred. So how bucket handle movement during quiet respiration or tidal respiration. So this way, during inspiration, the bucket handle movement takes place in the lower rib cage. So now we'll see the crural portion of the diaphragm. I have already told that this will have an indirect action but not the direct action on the inspiratory effect. Okay, so this crural portion of the diaphragm, so where these fibers are attached, so these fibers are coming from L1 to L3 vertebral bodies, isn't it? This has less direct inspiratory effect. This will have very less direct inspiratory effect on the lower rib cage than the costal portion. So that means these fibers will have less effect on inspiration than the costal portion. So what is the indirect action of these fibers? That means the action of crural portion. What is the action of the crural portion means? It helps in the pulling of the central tendon downwards. It helps in the pulling of the central tendon downwards. So central tendon ni downward ga pull cheyadaniki crural portion useful avutundi during inspiration, which causes increasing intra-abdominal pressure, and this pressure is transmitted across the opposite diaphragm. So సెంట్రల్ టెండాన్ కిందకి రాగానే అబ్డామినల్ ప్రెషర్ నుంచి వచ్చే ప్రెషర్ని అపోజిట్ డయాఫ్రామ్కి పంపిస్తుంది అనమాట. సో దట్ ఫోర్స్ ఈస్ ట్రాన్స్మిటెడ్ అక్రాస్ ద అపోజిట్ డయాఫ్రామ్ టు హెల్ప్ ఫర్ ద ఎక్స్పాన్షన్ ఆఫ్ ద లోయర్ రిబ్ కేజ్ and helps in the expansion of lower rib cage. Okay, so this is the thing happening during quiet respiration, respiration. So all these steps are taking place during inspiration only. All these things taking place during inspiration only. So during expiration, all these forces come back. So when this active muscle contraction ceases, the domes return to their original position. The dome returns to their resting position within the thorax. So that means which helps in expiration. To understand this thoraco-abdominal movement during quiet respiration, you have to know the pressures which are generated inside the thorax and the abdomen. So you people know that diaphragm is separating thorax and abdomen, isn't it? So what is happening during inspiration? So there is a descent of diaphragm taking place. Then what happened to the space inside the thorax? The space inside the thorax increases. If the space inside the thorax increases, what about the pressure inside? Pressure increases or decreases? Definitely the pressure is going to decrease because the space is increasing. So the pressure already, that intrapulmonary pressure which is already present in the thorax are going to decrease. Okay, so that means which is responsible for inspiration? ఎప్పుడైతే థొరాక్స్లో స్పేస్ ఇంక్రీజ్ అవుతుందో which helps in the suction of air inside the lungs. Okay, so that means intrathoracic pressure, or we can call it as intrapulmonary pressure, decreases, which is responsible for inspiration. Okay, so ఇక్కడ intrathoracic pressure, so intrathoracic pressure or intrapulmonary pressure IPP is decreased during inspiration. What about the intraabdominal pressure? Intraabdominal pressure is increased. So this intraabdominal pressure only helps us stabilizing this central tendon, okay, which helps in the expansion of the lower rib cage. That means the intrapulmonary pressure decreases and the space inside the thorax increases, which helps in taking in air. Okay, and once this intra-abdominal pressure is increased, what happened to the abdominal contents? The abdominal contents are displaced annaru. So displaced caudally అని చెప్పాం. So exactly the contents are displaced anteriorly and laterally. Anteriorly and laterally. Anteriorly and laterally, these contents, these abdominal contents are displaced. Okay, so what happens if this active muscle contraction is ceases? ఏం చెప్పాను ఇంతకుముందు, the domes return to their resting position. Once this contraction, this costal fiber contractions are decreased, so decrease అయిపోగానే ఏమవుతుంది? సో బకెట్ హ్యాండిల్ మూమెంట్ కదా, సో అప్వర్డ్ వెళ్ళిన మూమెంట్, అప్వర్డ్గా వెళ్ళిన థొరాక్స్ ఈజ్ కమింగ్ బ్యాక్ అగైన్, coming back to its original position. So seize aye koddi the size of the dome increases, then the zone of opposition is going to increased again. So once this zone of opposition increased, again it comes to its normal position. So normal resting position ki rahagane, what happened to the pressure in the abdomen? So kindaku ostene pressure perugutadi. So what happened to the intra-abdominal pressure? This intra-abdominal pressure also simultaneously decreases along with the movement of the dome of diaphragm. So what happens to the intrapulmonary pressure then? Intrapulmonary pressure, so dome paiki వెళ్ళిపోగానే the space inside the thorax decreases. If the space decreases in the thorax, what happened to the intrapulmonary pressure? The intrapulmonary pressure increases. Then expiration takes place. This expiration in tidal breathing is a passive thing. So here no muscles are required for this quiet expiration. Okay, this is about the movement of diaphragm, the function of the diaphragm during quiet respiration. Now in the next video we are going to see the accessory muscles which helps in respiration. I have already mentioned the other accessory muscles. So now we will see what are the functions and its origin and insertion of all these accessory muscles very briefly, and we'll see the main function of these accessory muscles and also the abdominal muscles. And we are going to correlate with all these three things: diaphragm, accessory muscles. We are going to correlate all these things in a single step. Okay, thank you.